Leading medical researchers have discovered that most subacute and chronic back and neck pain is caused by an injury to or weakness of the extensor muscles, the muscles responsible for flexing and extending the spine. Isolating and strengthening these muscles with proper equipment provides the best long-term results for people with subacute and chronic back and neck pain. Most subacute and chronic back pain sufferers have tried exercising their back muscles at their local gym, done sit-ups, and a variety of other things. While these activities do have some benefit, they do little, if anything, for strengthening the muscles of the lower back. As long as the pelvis is free to move during exercise, the larger hip and leg muscles perform the work, while the low back muscles remain weak and inactive.
In order to meaningfully strengthen the back, you have to immobilize the pelvis. The muscles that move the pelvis are very, very powerful. So you have to have some way to immobilize that pelvis, and it takes a fairly complex piece of equipment in order to do that. The equipment's not available at the health clubs.
Now watch what happens when the hip, gluteal, thigh, and leg muscles are immobilized. With the pelvis secure, the low back muscles are isolated and perform the exercise without involvement of the larger muscle groups. To selectively exercise muscles of the lower back, it is absolutely critical the pelvis be stabilized. This can only be accomplished using the specialized MedX lumbar extension machine in the following manner. An adjustable footrest is used to apply a force along the long axis of the lower legs that moves the legs upward and back. However, the knee and thigh restraint prevent any vertical movement of the legs and redirects the force down the femurs so the pelvis is pushed back into the circular pelvic restraint pad. The combined action of these restraints prevents backward rotation of the pelvis during the exercises and ensures proper strengthening of the low back muscles. Now, let's take a look at a side-by-side comparison of the effect of pelvic stabilization. On the left, hip function is demonstrated. Hip function does very little for muscles of the low back because, without pelvic stabilization, larger muscle groups such as the hip flexors, thighs, and hamstrings take over and perform the work, leaving low back muscles weak and inactive. On the right, lumbar function is demonstrated. Notice the difference in the lack of pelvic rotation once the pelvis is stabilized by the MedX lumbar extension machine. The low back muscles are forced to do the work without the assistance of larger muscle groups.